If this is your first time to get lip fillers, I think it's important to understand what's going to be taking place. During the procedure, I like to use a topical numbing medication. That makes it for a lot more pleasant experience because lips tend to be a sensitive area. The majority of my patients, after I use that topical anesthetic, no discomfort during the injections. There's also another medication in there that helps shrink down those blood vessels, which minimizes your risk of having any bruising and does minimize the risk of swelling. But one of the biggest questions that we get regarding what to expect after lip filler is how much swelling am I going to get? As far as the lips go, they tend to swell more than most areas of the body because they have such a good blood supply. Ways to minimize that swelling is after the procedure, you can take a non-steroidal anti-inflammatory drug like ibuprofen. It's important not to take that ahead of time if you can be off of those to minimize your risk of bruising. You can use cold compresses. I provide my patients with a cold compress to use for the remainder of that day. And if the lips still tend to swell too much, there are some other medications that are prescription-based that we can give. Now, not everybody does swell up, but it is important to realize that this is one of the more common side effects or treatment-related issues people are concerned about immediately after treatment. Again, not everyone develops that swelling. If you do develop it, it'll be gone in about 7 to 10 days, up to 2 weeks. So it's important to plan that as far as any events that are coming up. But the lips do go back down to the size that we had them on the day of injection. So I like to tell my patients, if you liked it the day of injection, you're going to love it in 2 weeks.